You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. The Dish on Health IT host, Tony Schueth, CEO of Point of Care Partners, is joined by co-host Kendra Obrist, senior consultant and payer strategy expert here at POCP. They'll be speaking with guest Anthony Murray, Chief Information Officer of MRO, to delve into the current state of interoperability with a special focus on payer-provider data exchange. This panel of experts will also explore opportunities for various stakeholders and examine the regulatory landscape shaping this crucial aspect of health IT. We hope you enjoy today's episode. If you have ideas for future topics, email us at podcast@pocp.com or submit suggestions on our podcast page at pocp.com.
Hello, everyone, and welcome to The Dish on Health IT, where we invite health IT innovators and trendsetters to discuss some of the biggest news and most significant milestones in the field. Point of Care Partners is a health IT consultancy and trusted third party working with stakeholders across the healthcare ecosystem to provide independent, objective insights and strategic recommendations rooted in our deep expertise. I'm Tony Schueth, CEO of Point of Care Partners, and I'll be your host for today's episode. I'm joined today by my co-host, Kendra Obrist, Senior Consultant and Payer Strategy Lead here at POCP. Kendra is known for her deep understanding of payer strategy, interoperability, and the complex dynamics of provider-payer data exchange. Today, we are thrilled to welcome Anthony Murray, Chief Information Officer of MRO. Anthony brings a wealth of experience in health IT and will share valuable insights into the current state of interoperability with a special focus on payer-provider data exchange. We'll delve into the opportunities for various stakeholders and examine the regulatory landscape shaping this crucial aspect of health IT. But before we do that, I'd like to ask Kendra to introduce herself and share what she's looking forward to exploring in today's conversation.
Hi, everybody. Thanks for joining us. I'm Kendra Obrist. I'm a senior consultant with Point of Care Partners, and I've spent most of my 30-plus career in health IT focusing on the area of payer-provider interchange. And most recently, as many people are, focusing on the topic of interoperability and bidirectional data exchange. I'm thrilled to have a chance to talk to Anthony, who spends his time, more on the provider side of the house. I spend more of my time on the payer side of the house. So I think we'll have a good dialogue about this topic.
Thanks, Kendra. Now let's meet our guest, Anthony Murray. Welcome. Please take a moment to introduce yourself, including your background, and then tell us about MRO.
Tony, I'm super happy to join you and Kendra today on The Dish. Thank you for having me. Kendra, no friction today between the payer and provider. We know that would be a thing. I've been working in healthcare for over 20 years. I started out in the pharmaceutical industry and then moved on to clinical manufacturing, where we would build you a lab, sell you the beaker and the DNA to put into it. And then about 16 years ago, I landed in something that was the release of information space, which was a thing that I really didn't even know existed. And I have just learned so much about healthcare and how healthcare information is exchanged or struggles to be exchanged. So I'm really excited about the conversation today. The organization that I work for is MRO, and we are really trying to advance and accelerate clinical data exchange across organizations like payers and providers. We are a leading health data management company, so we cut our teeth in that release of information space, and we have wrapped technology around class and valued services for about 20 years. So a lot of experience in exchanging this information and the challenges and complexity of what we would think of as or should be an easy thing when somebody's just looking to get access to medical records and medical information.
Absolutely. Thanks for that overview, Anthony. Now let's dig into our discussion. From your vantage point as CIO, what do you see as the biggest challenges payers and providers face when it comes to seamless data exchange?
Tony, that's a lot to unpack. Let me get on my list. One, no, seriously, there's just so many things, but at the core, I don't know that the challenges have really changed that much. If we think about it, silos of information, all implemented, used, and designed by different people for different purposes. And I'm not sure that interoperability was at the top of the list when they were building these systems or their workflows. And if we think about the sheer demand of the information that's now being asked to be exchanged, how do they locate it? How do they know where to go to find it? How do they make all of those connections? How do they invest into that connectivity to handle what was normally an incredibly manual process and do that while actually honoring all of the compliance and privacy things that go into maintaining HIPAA compliance, providers, policies, and procedures, and supporting minimum necessary so the requester gets what they want when we start to exchange information more autonomously, more automated, more digital. So I just think that those continue to be really big challenges.
Absolutely. And Kendra, you're familiar with and work a lot with one of those requesters being the payers. Do you want to add your 2 cents on this?
I think that, the challenges that Anthony mentioned are definitely there, just knowing where to find it. I think there's an additional challenge that is becoming more understood as interoperability advances, which is within the data itself. So to your point, the data was created not for the purpose of sharing it. It was created for all a variety of different purposes. And so payers are receiving data from many sources today and find that the variety in the data that they're receiving, even if it's received in a standard form, it's just highly variable. So different EHR systems kind of put things in different places, and different providers, document things via clicks better than others. And so understanding sort of the data itself, I think, is a challenge that is growing as more and more data is exchanged.
Absolutely. Thanks, Kendra. So I want to talk a little bit more about a broader trend, at least something that's given a lot of lip service, and that is around being patient-centric. What technological or strategic barriers are most difficult for payers and providers to overcome when it comes to not only streamlining things for providers and payers, but to better cater to patients? Anthony, what are your thoughts on that?
Sure. I probably think one or two things about this, but the one thing that I think is really positive is the whole concept of like a patient portal. I just think they've come such a long way. I love my little app on my phone because if it's not on my phone, it actually doesn't exist. And it just really allows patients to be able to engage the way that they want when they want to. But when it comes to really the challenges, Kendra, I think you mentioned it in part of your opening, which is that real-time bi-directional sharing of information at the time when it's needed, I think is still one of the most critical pieces that is missing and presents a lot of opportunity, but a lot of challenges. How do we get information in front of the provider at the point of care? How do we share back that case management, utilization management in near real time when it's actually useful? And how do we not let the process of healthcare drive and distract from the mission of healthcare, which is actually to deliver service?
Kendra,
what are some of your thoughts on that?
Yeah, I think I agree with you. I love my app on my phone also. But I think for payers, providers have always thought of their data in the form of a patient. Back when it was a patient chart, right? Every patient had their own chart, right? When it was paper. So they've always thought of their data in a patient context. Payers have always thought about data sort of in a different way. They have claims data, and they have enrollment data, and they have provider data, and now they have clinical data. And so they sort of view it in this sort of silo by description rather than viewing it as patient data or member data across sort of all of those different domains. So I think it's a real sort of orientation shift for the payer community to think of their data as patient data or member data and not as, some other classification.
So you mean I'm a person now, not just a number?
Yeah, you have a number though.
That's fascinating. So my next question is related to something we at POCP work on a lot, which is collaborative initiatives. First of all, I think we should acknowledge that there can be a bit of animosity between payers and providers. Yet we've seen the benefits of stakeholders stepping out of their silos to gain different perspectives and better inform how to solve common industry issues. And we've seen some really great payer-provider collaborations through our work as the program manager of the Da Vinci project. I want to ask you to share any examples of payer and providers working together to great success. I think the more we spotlight successful collaborations like this one, the more they happen. Kendra, do you want to take that?
Yeah, sure. So I think it's interesting. So you mentioned the accelerators, but also I think we're seeing more localized collaborations happening, whether that be at a state level. There's not to mention, I'm not naming names. There are a lot of states that have developed collaboratives that are either bound by cities or the counties or the states where they're trying to bring payers and providers together, largely around meeting the new regulations, because it's such an intertwined workflow with everything that's required in the new regulation. So both at sort of the state level and also just very locally. So the payers that I'm working with around complying with the new set of regulations are all identifying, okay, what are my provider groups that are fit the right profile? They're friendly to me, they're willing to work, they've got reasonable technical competency that I know I can sort of, as I'm developing my APIs and planning for these interactions, I can work with my provider community to make sure that they're going to work for both of us.
Thanks, Kendra. Anthony, do you have anything you want to add to that? Any examples?
Yeah, we tease about the friction, but I think you're right. When we get people together and we really talk to each other and try and solve common problems, we do see really good results. And I know Kendra's leading a lot of that exercise, so I respect that and the work done out of the accelerators. We have a very forward-thinking payer that's part of our client base, and they really came to us and asked, how do we help them solve some of their challenges, which we've talked about, which is, I've got this dispersed provider base that are all in different technologies. None of them really work seamlessly from each other. How do I get it into my systems? And we're seeing a lot of problems around the speed of clinical data acquisition and the quality of that data. So we worked with them, met with their providers, built some assurances, and put all of the necessary controls in place to enable a digital connection that would allow the provider to seamlessly exchange information and feed information to the payer. And that's really achieved an improved quality measure score on average by over 63% across a variety of measures. And then they work that into their value-based care program so the providers get a little bit more back when they build the digital connectivity, which also takes pressure off of them from being able to support those demands for information sharing when it's just happening securely, digitally in an automated fashion when they know all of their controls are already in place. So we were just very pleased about the success of that program. We continue to look for ways to bring that to our provider and payer base.
Wow, that's a real success story that should be shared. So I'm glad you're doing that here. One of the reasons collaborations could be so beneficial is because they can challenge long-held perceptions. We at POCP work with stakeholders across healthcare ecosystems, and often we see stakeholders hold on to misperceptions, either about what their customers think and need, or perhaps about the capabilities of their own organizations. In your own work, what are some of the common misconceptions you come across with your customers or stakeholders that you work with? Anthony, do you want to take the first shot at that?
Yeah, I think it's a great question. I think I'll go with that digital is easy, and that once you've done something once, you can just repeat it over and over again. And what we know is that that's not really the case. A former boss of mine said that this is a business of exceptions, which means that we are all exceptional people, but how do we build technology to handle what a person would normally have to assess, analyze, verify, and validate? So just because we did this once in one place, understand that it's going to be a long road to repeat it somewhere else. You've seen, an EHR, you've seen one EHR. So that localization needs to be handled and managed. So just because we get a digital connection up, it doesn't mean that we can service everything all at once.
A business of exceptions. I like that. A wise boss that you had. What are your thoughts on misconceptions that payers tend to have?
So I think one of the things that I'm hearing a lot lately is around sort of the topic of technology, and is this world of FHIR and APIs really going to happen in healthcare and happen sort of in a big way, right? And I think there's a lot of payers that are still very much in nothing's going to be any different. Then this is just another set of work that we have to do. And I really have a very different perspective on it. And many of the forward-looking payers do also, on the fact that, this is again an instance where the government is driving an agenda forward, and they're using sort of everything at their disposal to make it happen. They're using regulation, they're using incentives, they're using contracting power, the proposed federal HIT acquisition rule that basically says, if you contract with the government, you're going to buy health technology, it needs to be certified. That's going to have a big impact on the industry. And I think finally, I've been trying to solve some of these problems in my whole 30-year career in healthcare. So I'll be happy to see some of them take traction before I retire. But yeah, I think thinking that this is just another activity that isn't going to yield results, I think is a misconception. And I happen to believe that it's really not, that it is going to happen this time. It happened with electronic claims. It happened with EHRs and e-prescribing. And now, in this next 10-year cycle of regulation and agenda driving by the government, it's going to happen with interoperability. And it doesn't happen overnight, but I think it's going to happen. And we'll see the transformation of healthcare, much like we've seen other industries like financial services go from, you walking into the bank and writing paper checks to how we all handle financial services today online on our phones. I haven't been in a bank in I don't know how long.
I'm not even sure I could write a check today.
Right? I don't know where mine are. I don't
know. Those are some really, really fascinating insights, Kendra. How do you get your clients to think more strategically, a little less about checking the box, but think about this opportunity that they have if they do sort of the lowest common denominator, but if they do more, they could gain a competitive advantage or have a greater impact. How do you get them to think in that way?
Yeah, so I think I've actually been really, really pleasantly surprised in the last several months in working with clients around compliance for 0057 that they are actually thinking that way. They're saying this is a tremendous amount of work that we have to do, and we really want to get value out of it. And I think they're looking at each area and saying, okay, if I have this data, how can I do more with it throughout the enterprise? And if I have to share this data with my partners, and it's still a have to share it, if I have to share it with providers, for example, how do I make it the most useful for them, such that it helps achieve the things that we want, better care for the members sort of being front and center there. So I'm seeing a lot of focus this time around, unlike the last time, on payers really saying, how do I get strategic value out of this and maintain a competitive edge?
Anthony, how do your clients react to that? And how do they think of things more strategically? If they have to do something, how can they sort of take advantage of that opportunity?
Yeah, I like Kendra's point just about the fact if they have to invest, let's maximize it. I think is super cool and critical. From our perspective, what we're seeing is, Kendra, I think you said it earlier as well, the concept of starting to think about how they look at their data differently. So look, instead of claims data I can't remember the other quality that you posed, but looking at it from a patient perspective. And then from the providers, what we're seeing is, how do I look at my workflows differently? Because the need to protect information is going to change because of these interoperability rules. Nobody wants to call out the exceptions because they can't perform something for a technical reason. And they know that with the change of landscape from the regulatory pressures that are out there, that the way that they used to catalog information isn't adequate anymore. There would be pieces of information that would need to be held private or sensitive that are just smattered across the medical record because it was never a privacy thing or a sensitive information. So I just think that those are the challenges that we're seeing a lot of different thought, which is how do we manage our workflows? How do we get our actual physicians to get on board with putting things into the right elements and using more contextual references to do better data classification, as opposed to just putting everything to a freestanding note that is tough to protect.
Kendra, it's interesting you mentioned 0057. My next question sort of touches on that, and really the regulatory landscape, specifically as it relates to setting strategic priorities. Earlier this year, CMS 0057 rule was passed, which intended to streamline prior authorization and improve interoperability. This rule is spurring the strategic priorities of payers and will have a far-reaching impact on payers and providers. What are your thoughts about the impact of 0057, Anthony?
So we're not solving those particular challenges, but I think everybody wants to improve the prior auth workflows. So I think the whole piece is the government kind of stepping in and mandating these things is creating an environment where they're pushing us along. So whether we can meet the deadlines or how challenging it's going to be, who's paying for all these investments, I think are tough problems that we have to solve, and they create a lot of pressure on the provider who's already tapped for money. The payers are also under a lot of pressure around their profitability as well. So where do these investments come from? Then how do you maximize it? I think everybody wants to make patient engagement better. So an individual access API is a wonderful thing. Sharing information payer to payer, frenemies, and all that. Again, in theory, it's all about making the patient experience better. So prior auth, again, it's just another way that we can actually make care more important. We'll see how it goes. I'm super interested to hear how Kendra is viewing this because she's really plugged into their perception and the activity. But I think the pressure is good because it nudges us forward. I think when we start to think about carrots and sticks, though, the sticks hurt when we just can't keep up because the technology wasn't really invented yet. Like, we're creating this stuff now.
Kendra, do you want to respond to that?
Yeah, I mean, 0057, as I affectionately call it, because the real name is just too long to say more than once a day. It is really, it's having a significant impact on payers. It is a lot of work in what maybe felt like a lot of time that is now a third of the way gone. So it was kind of 3 years worth of time when it first was finalized early this year. Now it's pretty rapidly becoming 2 years worth of time for the farther out, but in 1 year worth of time for the January 2026 requirement. So it's becoming very real. And I think payers resource pool, their business resources, because this isn't a technology only project. Their business resources, their technical resources, their legal and compliance resources are going to be stretched for the next 24 months, struggling to meet these. I mean, they're not insignificant requirements, and I think the payers are realizing that, wishing maybe they had started earlier than some of them did. But I think it's going to be a big resource pull on the payer community and the provider community. And, you spend more time with providers than I do, Anthony, but I'm hearing most of them indicating that they are relying on their electronic health record vendor to give them what they need to be compliant. And that's kind of the, sort of they've got to give us what we need in our AHR system to be able to do these things. And while I don't think that's wrong, I think it would be great to see a little bit more involvement in defining sort of what does that mean? What are they expecting from their AHR vendors?
That's just such a great point. And it does echo what we hear when we do interoperability presentations for some of our providers. They look at me like they hadn't really thought about it. It's an afterthought because they are so reliant on their technology vendors to provide those answers. And I'm worried the same way you are, which is if they don't get engaged soon, then number one, your EHR is telling you how to do data exchange, which I don't think is really what providers want. Or two, there's work behind it because of all that localization that we just talked about before, which is great. We've given you the tool, but now you need to configure it for your environment. You need to get on board. And that's a lot of where we spend our time, is trying to have those conversations, educate that provider community on what these like regulatory motions really mean when you start to look into the crystal ball, and then how can we help, and other organizations like us help them along.
Both of you make really, really good points. You both also acknowledge that the federal government has had something to do with driving sort of some of these changes in healthcare. So let's acknowledge for a moment the fact that we've just come through a historic election and have a new administration coming in, bringing with it a lot of uncertainty around what it'll mean for health IT. What will be rolled back, what will be slow rolled, what new rules will come in. Do you have any thoughts or advice that you'd share with how to navigate uncertain waters? Anthony, let's start with you.
No. I think it's totally murky. I do think it's unprecedented, like acknowledging it, knowing that it's going to be different than what it looked like yesterday. I don't know how that's going to manifest itself. So being engaged, I think, is really the most critical thing, is staying informed of what's happening. There were new SOPs published yesterday for things like TEFCA. There's a couple of lawsuits that are out there that potentially could even pull forward like the Chevron rule. So like, how are all of these things going to come out when now the government can be questioned for overreaching? Did they overreach on any of these? Are they continuing to overreach? Is that just going to change anything? Does it bog it down in court? I think there'll be a lot of grab the popcorn and get excited about watching what plays out. But the uncertainty is real. So being prepared, understanding what your needs and strategy and your drivers are, I just think is critical for you to hold on to what you and your organizations are already working on, and then deal with the changing of the landscape as it comes.
And I think that's a good point. Keep working on what you're working on, because many of these things are to the benefit of respective organizations, our clients, to patients. The prior auth, for example, rule, if we can automate and streamline prior authorization, the value is pretty substantial. Kendra, do you agree? Do you have any other thoughts on what this new administration brings to the table?
I do agree. I like it. Keep working on what you're working on until something changes, right? You can't worry about it every day. I was on a call earlier this morning with one of our payer clients, Tony, and they asked me that very question in this rather large group setting at a payer client about what I thought the change in administration was going to do, and I kind of pled the fifth. I'm like, well, I'm not weighing in on that one with this audience, but I think the final rule for 0057 was actually drafted and published in proposed form under the previous Trump administration, and so while anything could happen, and I certainly don't make predictions like this, but I wouldn't expect a big, we're going to just go change all of that, because they were, that administration was the original author of that rule. And while it had some tweaks happen to it sort of in the intervening years, it still remains substantially similar to what it was when it was originally proposed.
Yeah, the original Trump administration, was supportive of health IT. And one of the things that I say a lot is that really both parties see health IT as part of the solution. And so, it's exciting, and I do think our clients should continue to work on the things that they're working on. So we're winding down now to the end of our episode. When we do this, we like to give our guests one last opportunity to share final thoughts or a call to action to the industry as we close out our episode. What are your final thoughts or action that you would wish the industry would take? Anthony, let's start with you.
I think I'll get up on my soapbox and say that none of this has to happen to you, but it can happen with you and for you. So get involved, be cognizant of these changes. I think the accelerator programs are still underrepresented. I think there's a lot more that we can do in groups like that and coming out of Sequoia to just be part of those decisions and part of those conversations. And when the government puts out new rules and is looking for commentary periods, like, do not lose your voice. Put out your concerns, put out your pros, but at least get engaged so that we can all really point towards something that we think is going to be a better way to do healthcare in the future.
Kendra, do you have any final thoughts?
Yeah, I think I encourage pretty much anyone I talk to on this topic to sort of think about the art of the possible and what healthcare could be if we take advantage of the technologies. They're not new technologies that are available. They're new to healthcare, but they're not new technologies. And as I look at sort of the younger generations and their expectations out of the healthcare system are very, very different than their parents and certainly their grandparents' expectations. And they expect a real-time digital experience, like they experience everything else in their lives. And healthcare will get there. And I guess I'd love to see us sort of looking towards that and planning for that and making that happen rather than sort of kicking and screaming against it.
Yeah, me too. I'm not crazy about the kicking and screaming part. So in closing, I'd like to thank my POCP co-host and payer strategy expert, Kendra Obrist, and our wonderful guest, Anthony Murray. It's been fantastic getting to speak with each of you and hear your perspectives today. A friendly reminder to new listeners that you can find us on Apple Podcasts, Spotify, or whatever platform you use to pick up your podcasts, including Healthcare Now Radio. We also post videos of our podcast episodes, sometimes longer versions, on the POCP YouTube channel. And don't forget, Health IT is a dish best served hot.
Is it a challenge to stay on top of interoperability regulations and the flurry of activity with fire accelerators? Email us at interopoutlook@pocp.com to learn more about our new Interoperability Outlook subscription monitoring service.